There was relief for families and residents of Chachi, a community in Tapa local government area of Niger State, as a team of Mission for Education, Social and Health (MESH), an NGO arm of Nigerian Supreme Council for Islamic Affairs, visited the community to render free public healthcare services. Chachi residents in their numbers, including women, children, youths and the elderly, besieged the Dakachi's palace on Saturday, the venue of the medical outreach, to take advantage of the free medical services brought to their doorstep. The outreach, which was organized in collaboration with the Islamic Medical Association of Nigeria (FCT) chapter, featured free consultations, malaria, typhoid, hepatitis B, HIV, and high blood pressure tests, among others. Also, items like clothes, shoes, books, drugs, and toys were shared to members of the community. The medical supervisor on ground to inspect that things were going smoothly, Dr. Lawal Abdulhakim, spoke to Signature TV. Dr. Lawal Abdulhakim, who doubles as the chief consultant of Maitama District Hospital and the state Amiru of the Islamic Medical Association of Nigeria (FCT) chapter, said the medical outreach to the rural community was born out of the desire that those in rural communities lack access to basic healthcare services and cannot afford medical bills in private hospitals.
We are equally running a weekly outreach program at the National Mosque Clinic. But since the one inside town is not really for the grassroots people, that's why we decided actually there is a need for us to come to the grassroots. And the choice of Chachi came up based on survey and the need of the people here. It's a free medical services just to screen for basic common illnesses, malaria, hepatitis B, and HIV, as well as to treat for common ailments that are presented, commonly malaria.
Some of the medical team members spoke on their assessment of the medical tests done in the community.
A wannan gari alhamdulillah mun zo mun yi tests, alhamdulillah kaman test na hepatitis.
In this community, we have conducted series of tests, but most people here are down with malaria.
Malaria is endemic to this area, and I'm particularly worried about the pregnant women who are supposed to be receiving antenatal care, because we know that malaria in pregnancy is very, very bad, it's very, very dangerous. So I think it would be nice if the community is being educated on different ways of preventing malaria.
Most of them, their BP is so normal. It's not much higher as the thing that some people are expecting. It's normal according to how was been checking it.
The lead program officer of MESH, Hajia Khadija Oladipupo, who decried the absence of healthcare facility in rural areas, called on civil societies, non-governmental organizations, and faith-based organizations to rise to the occasion and assist those in the rural communities, as government cannot do it all.
Government cannot do everything alone. That's why the civil society organizations, faith-based organizations come together to reach those communities that does not have the government, federal government access present. So that's why we're here.
It is not often the people of Chachi community sees such humanitarian gesture. The Dakachi of Chachi community, Musa Abubakar, thanked the organizers of the outreach and the entire team members for finding Chachi worthy for the medical outreach. He called on government to bring governance to the grassroots.
Abin muna so gwamnati ta taimake mu shine a gyara muna makarantu a kamuna ruwan sha.
All I have to say is to thank you so much for rendering free medical outreach to us in this Chachi community. May Allah reward you abundantly.
Some of the beneficiaries, who could not hide their excitement, thanked the organizers for such an opportunity.
The way this organization have come to make this medical outreach today, that is how government agency have been doing. It will go a long way to save many lives. You see, like I said earlier, many people don't like to go to the hospital when they are sick, although we have a health center here, but still because they cannot be able to offer a lot of tests, and people are also scared of the amount of money they will pay there.
To sai dai mu ce muku mun gode sosai da taimakon da kuka kawo mana garin Chachi.
We are pleading with government to renovate our schools, provide water and roads. We are suffering in this community.
The medical outreach was brought together by the Mission for Education, Social and Health, an NGO arm of the Nigerian Supreme Council for Islamic Affairs, in collaboration with Islamic Medical Association of Nigeria, FCT chapter. In Niger State, Marvelous Oboman for Signature TV.